Welcome to the 9th UERM College of Medicine Alumni Association Incorporated Annual Convention, Usapang Buhay Doktor, a webcast series. This is the last of the 4-week series featuring the 23rd Potenciano Baccay Jr. Memorial Lecture with a proud member of Medicine Class 96, Dr. Michael Martin Baccay, as a speaker. We will also feature the medical education and training under the Better Normal with the Medicine College Dean, Dr. Norbert Tingling Uy. Dr. Jennifer Regina Mejia Muin will chair today's session. Dr. Muin is a primary care physician at the Mejia Muin Medical Clinic and a board member and the treasurer of the Zur RX Pharmacy.
Greetings everyone. This is Jennifer Mejia Muin of Class 1996. Welcome to the Webisode 4 of the Usapang Buhay Doktor webcast series. The first part of this session is the Dr. Potenciano Baccay Jr. Memorial Lecture. This year's lecture is extra special because of the chosen speaker. This will be hosted by our batchmate, Dr. Roger Badillo II.
Thank you very much, Jing. My name is Dr. Roger Badillo II. Good evening, everyone. I am part of the celebrating class of 1996. And tonight may be the last of the Usapang Buhay Doktor series, webcast series for the celebrating class of 1996, but definitely not the least, because tonight we'll be having the 23rd Dr. Potenciano Baccay Jr. Memorial Lecture, and we have a very interesting program tonight and a very important guest. And to kick off the celebrations, we would like to call on the Chorus Medicus to start with our invocation and national anthem. you very much. Now we would like to call on Dr. Samuel Vincent Irastosa, MD, Batch 97, as the President of the UERM College of Medicine Alumni Association Incorporated, to give us a short opening remark for tonight's festivities. Sam?
Good day, everyone. Welcome to the 23rd Dr. Potenciano Baccay Jr. Memorial Lecture and the webinar on medical education in the new normal. An endearing and memorable event is eagerly anticipated as finally the son, Dr. Michael Martin C. Baccay of Class 1996, a Silver Jubilarian, has come to his own and will give honor to his father as the speaker. He will be taking on his advocacy that was and is inspired by his late father's celebrated and emulated life works. This will indeed be a momentous event. This will be followed by a webinar on medical education in the new normal. For this, we will have our hardworking and well-loved Dean, Dr. Norbert Lingling Uy, who has successfully maneuvered the College of Medicine through this pandemic. He will be joined by distinguished speakers of Class 1996, the Silver Jubilarians. So without further ado, let us watch and enjoy the memorial lecture and webinar.
Thank you very much, Sam. And the next part will be a short AV video presentation of the life and works of the person we are celebrating tonight, Dr. Potenciano Baccay Jr., UERM Medicine Batch 1964. Please enjoy the video presentation.
Dr. Potenciano D. Baccay, or Mike, as his friends fondly called him, graduated from the UERM Memorial Medical Center College of Medicine in 1964. After graduation, he joined the center's residency program in internal medicine. He became the chief resident of the department on his third year. He subsequently started his practice as a consultant in internal medicine at the UERM Memorial Medical Center. In 1970, he trained under Dr. Beldin Scribner, who invented the Scribner shunt, and Dr. Thomas Mercioro, a kidney and liver transplant pioneer. In 1972, Mike turned down an offer to head a nephrology unit in Utah, USA, and came home instead. At that time, there were only 8 nephrologists in the Philippines. He then opted to stay and focused his activities in the College of Medicine and the hospital. The center's first renal transplant was done in January 1973 at the UERM hospital, led by Dr. Mike and a team of distinguished doctors. Soon after, Mike became more active in practice, more committed to the faculty and professional society, and more passionate about working for those with renal diseases. Dr. Baccay was instrumental in strengthening the Philippine Society of Nephrology and its specialty board. It was during his term as president when training programs in nephrology was accredited. The UERM training program in nephrology was one of the first accredited training programs in the Philippines. In 1981, the National Kidney Foundation Center, now the NKTI, acquired its legislative personality. A kidney center was the realization of a collective dream of nephrologists. Mike was the assistant director of NKI at the time of his death. Mike is an example of one who made his choices in life and loved and kept his options. He did say he would die at 45.
we now come to our first speaker for tonight. We are very lucky to have a colleague of Dr. Potenciano Baccay Jr. We have invited him over and we're very thankful for his time to give us his own personal thoughts and his very own experience, knowing the man and remembering the late Dr. Baccay. Please allow me to introduce an equally distinctive colleague of the man we are honoring tonight. Our next speaker has graduated from UERM Medicine class of 1965. So he's actually one batch younger than the group of Dr. Baccay. He completed his OB-GYN residency at UERM in 1970 and is a diplomate and fellow of the POGS and the board member. He has also trained in gynecologic and diagnostic laparoscopy and served as the UERM OB-GYN faculty for the whole of 37 years, starting as an assistant instructor and eventually retiring as full professor sometime back in 2003. Sir is a former head of the Department of OB Gynecology at UERM, but not just in UERM, he is also former head of the Department of OB Gynecology at Viluna General Hospital, and up to the present, he continues to be a civilian consultant for the hospital. He was also a former assistant medical director and hospital administrator at UERM, and he was also a medical specialist too and senior consultant at East Avenue Medical Center. And last but not the least, our guest is also a reserved officer at the AFP Medical Corps with the rank of Lieutenant Colonel, the past president of the UERM Medical Alumni Association and also the UERM Faculty Club. He's a regular, a participant in most OB-GYN postgraduate courses, not just in UERM, but also in East Avenue and other POGs organized courses, either as course director, as moderator, facilitator, and lecturer. Tonight, we're very happy to introduce and to have with us to talk about his experiences knowing the late Dr. Baccay. I am very happy to introduce Lieutenant Colonel Dr. Manuel Ramos Jr. Good evening, sir.
Good evening. I welcome this privilege to talk about Dr. Mike Baccay. Last year, Dr. Benjamin Policarpio narrated their journey as residents. He described that they managed to support their growing families on a salary of $175 a month. During the mid-60s, UERM was still a small community. There was only the College of Medicine, the College of Nursing, and the UERM Memorial Hospital. Everyone was a familiar face. The ladies of the Women's Club were beautiful, but there were more pretty student nurses on the campus. There were two fraternities competing for membership. Beta Sigma had 25 members in class 65. The faculty strength was less than 200. Most of the department heads and the professors were retirees from the UP College of Medicine. Some of the associate professors came from the other Metro Manila medical schools. Many of the assistant professors were those who just arrived from postgraduate training in the USA. Majority of them were UP graduates. Graduates of local residency training programs were appointed as instructors. The residents were considered members of the faculty with the rank of assistant instructors. Their primary role was to teach. They were the most powerful group in the hospital. Unfortunately, some of them abused this power. In each department, there were some residents who loved to mete out punishment almost routinely. Special duty was a favorite. The threat of extension was real, and points of special interest or PSI was almost routine. Since copying machines were not yet in vogue, PSI meant hours of typing or writing a synopsis of the journal article. Some parents were disappointed because their children could not join the graduation of UEMAAI at UEMAAI because they were still completing their extensions. Our class 65 were the interns at this time. Mike Baccay was our first year resident. We were acquainted and were friends because he was our intern when we were clinical clerks. 60% of class 65 went abroad. 40% remained to join residency training programs, start a general practice in their hometowns, or to get married. Agapito Uy migrated to Canada. The two classmates came home after training abroad. Dr. Bienvenido David at Makati Medical Center and Eduardo Hamelarin, who managed their hospital at Pagadian City, Zamboanga del Sur, with his American wife. Dr. Rene Edgar Mendoza, Dr. Bonnie Sousa, Butaran Pagaduan, and Dr. Edith Magos Regalado and myself joined the UERMMC faculty. Mike was a regular guy. A classmate relates that Mike did not know the rules of courtship. He said that Mike never asked him to bring flowers to Mayet, unlike the others during initiation rites. He just asked him to jump with each letter of his name that he spelled out. Another classmate said that Mike was patay na patay kay Mayet. However, there was one occasion when he invited one of the student nurses for a date, but she wanted to bring a chaperone. His classmate encouraged him to suggest a double date. They went to Santa Mesa Market, the present location of SM Mall. After merienda, they both realized that they did not have any money. Fortunately, the cashier accepted their story of leaving their wallets at their quarters. They were allowed to leave, but they came back to pay. There was no second date. As a postscript, the chaperone subsequently won the Miss Philippines beauty title. Most of the residents were single. The matching game was very popular. Some were willing victims. Several pairings led to the altar. When Mayet was on duty at the ER as ambulance surgeon, they would call Mike at the medical ward or vice versa. Everyone was happy when they started talking on the phone. If the conversation was too long, Melly, our favorite telephone operator, would interrupt by saying, "Excuse me, Doc, my incoming call." Mike was no angel either. One mid-afternoon at the residence quarters, he was playing a card game with several residents as kibitzers. He noted that the quarters grew silent and some of the onlookers were returning to their respective beds. He picked up his cards and slowly checked them. Then he heard a familiar voice saying, "Planchado na, Mike?" Dr. Romulo Guevara, the chief of clinics, was behind him. Unfortunately, the next week, a group of residents raided the Indians' quarters for a similar offense. Another comment about Mike was his neatness. His hair was always in place. His starched uniform still had its well-pressed look with no creases in sight, even after the end of a 24-hour duty. My classmates here and abroad have to the same or similar comments about Mike. He was one of the most popular and well-liked residents. He belonged to the Mabait group, which included Joven Quanang, Romeo Di Vinagracia, Agapito Tuason, Rolando Noche, Elsie Cacha, Mayet Carpio, Rafael Pascual, and Nancy Del Rosario. Everyone considered him to be a bright young resident who did not abuse his position. He was always eager to teach the interns. Some describe him as an intelligent and serious student of medicine. He was considered as kind and compassionate. He was consistent, strict, but fair. In spite of the negative attitude of some residents in each department, Class 65 survived. We had a 100% passing in the board exams. However, our class valedictorian set another record at UERMMC. The final grade of Dr. David Roble in anatomy was 1.0. This can be verified by our registrar. I close on a personal note. After over 50 years, I have renewed my personal relationship with Mike and his family. Your speaker, Dr. Michael Baccay, son of Mike, is a classmate of Dr. Micaela Cabuncal Ramos, my daughter-in-law. Congratulations to all the celebrating classes. Mabuhay UERMMC.
Thank you very much, Dr. Ramos, for that very heartfelt recollection of your experiences with Dr. Potenciano Baccay Jr. And now we come to the main event for tonight, which is the introduction of our guest lecturer. Right. Our speaker tonight is not just a batchmate and a silver jubilarian himself, but somehow represents so much more for this 23rd edition of the annual Potenciano Baccay Jr. Memorial Lecture. And it is sort of a watershed event for our speaker because everything has sort of come full circle. I might as well call it the sun also rising. But first, I have a disclosure because I have a personal stake in tonight's lecture because a significant part of my becoming a doctor I owe to our esteemed speaker, and I will tell you why. When I first met him on day one, first year of our medical school, June 1992, physiology lecture class, ang Mr. Lecturer ay naka-black leather boots, faded maong pants, round neck white t-shirt that says Hard Rock Cafe with a characteristic southeastern twang. And true enough, he was stateside. He was from Virginia. Sabi ko, patay. Mukhang slacker. Baka wala akong makokopya dito. And talk about judging people by their looks. Uso naman yan noong unang panahon. Hindi pa naman tayo politically correct noon. So, and then later on, I will realize that I was so wrong and I couldn't be more mistaken. Countless times he has saved me in those early attendance sheets as early as 7 a.m. Mga time in namin. And every time I was late, and that was a lot of occasions, from the clinical lectures all the way to the junior internship. And kasi ang apelido namin was Baccay and Badillo, magkasunod kami parati sa attendance. Parati siyang maaga gumising at pumasok sa duty. And para hindi ako ma-repeat rotation, sa dami ng late ko, he was always to the rescue. Sabi ko parati, sorry Mike, malayo kasi bahay ko sa Quezon City. Kaya parati ako nalilate. Tapos malaman lamang ko, siya pala nanggagaling Alabang araw-araw. And so I ran out of reasons. And ang handwriting niya, ang ganda, parang sulat ng babae. Madaling kopyahin sa quiz. Hindi siya nakakalito, sa totoo lang. So, on that note, I was mistaken on all fronts. Parang he was very conscientious and diligent in his schoolwork. And it was almost a miracle of sorts na hindi kami nahuli kasi parating pareho ang pirma namin. Pirma niya pala yun. Kaya sana walang hospital administrator na present tonight, baka bawiin yung diploma namin. Which leads me, bakit maaga siya parati pumasok? Kasi in fairness to us mere mortals, medyo, when he came into medical school, medyo lamang na siya sa edad sa amin noon eh. He was a couple years older than us. And comes with that, a certain degree of maturity. Mas mature siya sa karamihan. And you know how it is. The older you get, the early riser you become. So maaga siya gumigising on that note. At kaya rin maaga pumasok because there was somebody na sinasabayan niyang pumasok na maaga. At kung may Forrest Gump noong 1984 ay si Jenny, meron din siyang true love na Jenny. And it's quite a happy coincidence and almost a serendipitous event because he's now happily married to one of our batchmates, si Dr. Jenny Kiger, who's also a pediatrician from our batch 96. Hi, Jenny. Initially, he was quite well known among the consultants. And later on, we found out because it was because of the legacy of his late father. That's how well loved the father was. But I know he never really felt comfortable with the unwanted attention. But not long after, he would be also known of his own accord. He excelled in the academics and all the way through to the clinical rotations. That's how he worked. So, to give us a background of what kind of a student he was a high school valedictorian at De La Salle Subel. and went to St. Mary's College in Minnesota, USA for his undergraduate BS Biology, where he distinguished himself by making the National Dean's List and landing a St. Thomas More Scholarship. And then he went on to attend the George Mason University at Fairfax, Virginia, where he got his accent, and to finish his BS in biology. And after graduating after coming home back to the Philippines and eventually went to UERM College of Medicine and graduated top 10 of our batch, correct me if I'm wrong. He went to the UPPGH for his internship and eventually residency training in general surgery, and all the way to fellowship in thoracic and cardiovascular surgery, where he was also chief resident of the department. His CV is 3 pages long, back to back to back. So, tatalunin si homecoming chairman Rodney Jimenez. Muntik ako mahilo sa dami ng accomplishments and concurrent professional positions na hawak niya. But I was not really surprised a bit. Kasi early on in his medical schooling, he has shown great capacity for leadership. And ultimately, we know him to be very responsible, both at work and at play. To his family, his siblings, and especially to his mom. Not just the family, but the rest of the class. Parang si Mike is no man left behind. He was a kuya to everyone. And I really looked up to him and respected him. And I know a lot of us in the class did, not just in our class, but even those who were older and younger than our batches. By the way, mahilig din siyang kumanta sa class choir, every Christmas choir presentation. At kaya siya nandun dahil nandun na naman po si Jenny. Other than that, maraming beses ko po siyang nakasama sa mga, we have this impromptu 5-minute lunches beside the UERM hospital sa Ilocanas Eatery. Mike, you remember? Sa tabi ng hospital. At ngayon tuloy, I cannot help but think that maybe part of his success might have been the steady diet of sinigang na sinawsaw sa mayonnaise instead of patis. Sa kanya ko natutunan. So hanggang ngayon, hindi ko mawari kung anong siyensya ang involved doon. But apparently, it worked well for him. He has also presented winning cardiovascular papers abroad. And I also learned that he was past president in 2016 of the Philippine Association of Thoracic and Cardiovascular Surgeons. That gives us a pretty good idea of how old he is now. Currently, he's medical specialist 4 and the head of the Department of Surgery at the Mariano Marcos Memorial Hospital and Medical Center, run by the DOH, and is also chair of the Department of Surgery and Faculty and the Department of Anatomy at the Mariano Marcos State University College of Medicine. And still is faculty of the Department of Surgery at the College of Medicine at the University of Northern Philippines, and his hospital affiliations run back to back. He is with Lawag General Hospital, Ilocos Norte Provincial Hospital, Ilocos Sur Provincial Hospital, and so many other private hospitals in the north. So he's very busy and is very involved. And I understand that his talk tonight will digress a little from his TCVS background, but just a tiny bit, because we all know that his illustrious late father was one of the driving force and pioneers of nephrology and kidney transplant, not just in UERM, but also the setting up of the Philippine Society of Nephrology and and as specialty board chairman, as well as embarking on the training programs in nephrology all over the country. And his father was also assistant director of the National Kidney Foundation of the Philippines, which would later metamorphose into what we now know as National Kidney and Transplant Institute, which provides ultimately the hope of a kidney transplant to all patients from all over the country, regardless of social status. So, without further ado, ladies and gentlemen of the UERM medical community, fellow Silver Jubilarians of Batch 1996, to talk to us and share his ideas on continuing his late father's advocacy for kidney and organ transplantation in the Philippines. I am deeply honored to present to you one of our very own, truly a remarkable achiever and a dear friend, physician and surgeon and family man, and pride of our batch 96, the son of the man we are celebrating tonight, Dr. Potenciano Baccay Jr., the irrepressible, the unmistakable, everybody's favorite, the one and only, the other Mike, also known as the sun rising from the north all the way to Ilocos, Dr. Michael Martin Carpio Baccay.
Thank you, Roger, for that introduction. Very true introduction. And I'm happy that you remember all of our fun times. And hopefully in the future, we can continue with that with all of our batchmates. So I'd like to thank the UERM Memorial Medical Center Alumni Association and its officers for this opportunity to be the speaker for the 23rd Potenciano D. Baccay Memorial Lecture. I'd like to thank my batchmates for inviting me to speak about the visions of a man whom I respected so much and whom I miss so much. And I thank the organizers and also the small group that brought this lecture together for their continuous work despite my absence from the small Viber group. So this is my dad. We call him Papa or Pop for short. And you'll probably notice that where did he get the nickname of Mike? Potenciano Mike Danao Baccay Jr. Actually, my grandfather told me that Mike came from Maito. They called him Maito when he was a kid. And eventually, because Maito was difficult probably to use with an older kid, it became Mike from high school onwards. So it has no relationship to his Potenciano. That's why when he named me Michael, mapapansin nyo, wala akong junior. So Michael comes from his nickname of Mike. This is one of my favorite pictures because it shows Papa in one of his lighter moments when he would smile. Usually he's a very serious guy. I probably get his work habits. I got his work habits. He would come in late at night from a long day of work. He would drink a couple of beers to relax. And then he would talk to us. But on this occasion, I think he was flying to one of his conventions abroad. He had his picture taken while he was relaxing with a drink. And it's a very nice picture. My papa was a visionary. He had so many things he wanted to do. If you remember from the description of his highlights during his training, he had come back from the United States. A lot of his classmates who trained in the United States remained in the States, but he came back. He came back to UERM. He shared what he learned in nephrology from very, very important and distinguished professors in Seattle, Washington. He was active in organizing and developing the local society, the Philippine Society of Nephrology. He was very active in teaching. And one of his very important visions was he wanted to have very quality health care for patients with kidney disease, chronic kidney disease. He loved his patients. It's something that I learned from him because he would always talk about his patients. He would always talk about their problems. And he was very warm. He's very compassionate, which is something that all of us kids learned from him. So we talk about the population that my dad served and loved so much, the patients with chronic kidney disease. And if you will know, the burden of kidney disease is very, very heavy, especially in the Philippines. Worldwide, it ranks among the top 10 leading causes of mortality. In the Philippines, it ranks number 7 in terms of morbidity and number 8 in terms of mortality, according to the national statistics. I was able to talk to some friends at the NKTI transplant surgeon of the important like there and highlight regarding from the Philippine Renal Disease Registry. The latest figures coming out from 2019 will tell us that one Filipino will develop chronic renal failure every hour, and that 120 Filipinos with chronic kidney disease will go on to renal failure. That's per 1 million Filipinos per year. So 120 Filipinos per 1 million Filipinos per year. That's a very large number. And if you really calculate it, there will be around 10,000 to 20,000 new cases of chronic kidney disease and end-stage renal disease, the fifth and final stage of CKD, who will need to undergo dialysis per year. So it's a very serious problem. And when you talk about the cost, these patients are really in a bad situation because they spend at least 25 to 46,000 a month. Okay, if you talk about gross costs, even after removing benefits like PhilHealth and PCSO awards, they still spend a lot. And we're looking at about 300 to 500K a year just for treatment of their CKD. So it's a very costly disease. One of the dreams of my dad was to be able to contribute to putting up a place that could serve and give all the services necessary to take care of patients with CKD. I was fortunate enough that when he would come home, he would unfurl the original blueprints of the National Kidney Center, as it was known at that time. He would show me. He would show me the blueprints. This is what we're going to put up, Mike. This is what we're going to put up for our patients. And he kept at it every day. He was always on the phone with the engineering and architects who were helping them put up this center. And he would probably be very happy now if he could see what the National Kidney Center has transformed into, the National Kidney and Transplant Institute. Unfortunately, I did not train there, but I have visited it on several occasions, and it's a very beautiful place. He would have loved it. He would have been very happy to be there at this point in time and see that one of his dreams, one of his visions has actually taken fruit. When we talk about the services that he advocated for the chronic kidney disease patients, the most important ones that we know refer to renal replacement therapy. And I'm sure all of us doctors know about this. You have hemodialysis, peritoneal dialysis, and of course, the gold standard is always going to be kidney transplantation, although I don't perform kidney transplant myself. But I am involved in creating access for hemodialysis and peritoneal dialysis, which explains why I also have the same advocacy for these patients. And if we will look, more or less hemodialysis and peritoneal dialysis have steadily grown and are able to keep pace with the needs of our CKD patients. These are somewhat late figures. 2010, this is the best that I could get in terms of stats, but at that time they already had 423 dialysis units nationwide, and 20% of those had the capacity to do peritoneal dialysis. You can imagine 11 years later how many of those units have already mushroomed all over the country. I'd like to quote a very distinguished doctor who has involved herself in the advocacy for kidney transplant. She's presently the executive director of the National Kidney and Transplant Institute. She's actually a relative of my mom. They come from the same hometown in Paway, Ilocos Norte. And we have met on several occasions talking about kidney transplant. And Dr. Rose Marie Lequete mentioned that kidney transplantation is the best form of renal replacement therapy. Patients who receive a kidney transplant become fully rehabilitated and have optimal quality of life and the highest survival rate. For donors, donating one kidney and living with one kidney generally does not affect life expectancy or quality of life. And more importantly, they save lives. So KT, at the present time, is able to churn out about 4 patients per 1 million population per year. Okay. Talking to the transplant surgeons, they actually mentioned that there has been a downtrend in the number of kidney transplants done since 2008, when we became very strict with the commercialization laws, which were really needed to deal with organ trafficking. But at least at the present time, they are able to maintain these figures, although it's much less than what we actually need. At least the program is continuing. They have a very good, excellent transplant surgery program in NKTI, which graduates the transplant surgeons that we need to continue performing these operations. And the transplant surgery field is steadily growing again. Hopefully, we can catch up with the resources that they need to perform this much needed procedure. There is still a wide gap between kidney transplant and hemodialysis when we talk about the KT to HD ratio. If you will look at the figures, in 2010, the ratio was 1 kidney transplant per prevalence of 27 hemodialysis patients. In 2018, it gets even worse. It's a 1 to 50. Okay? But there still is kidney transplantation going on. We just need to deal with the factors that affect its procedure and its use in our CKD population. So these are the factors that affect decision making for our patients who probably will need to undergo CKD. Whenever I talk to my patients, I always make it a habit to ask if they have ever talked about KT with their nephrologist, and they do. Okay. The problem is they always mention the same things. Doctor, hindi namin kaya ang transplant kasi wala ho kaming donor. Okay. Wala ho kaming pera pang transplant. So it's the availability of donors, whether living or deceased, and the availability of funding for the transplant process that seems to be a major factor in determining whether or not a patient will go on to kidney transplant from dialysis. I went through the literature to find legislation that supports the development of renal care in our country. And there are two important bills. The first one is the Comprehensive Renal Replacement Therapy Act. It has undergone several revisions in the House of Representatives, but I think this bill has already been passed, and most of its important aspects, its important articles are presently being adopted in our healthcare system. The other important bill, which I think is still ongoing, is the Regional Kidney and Transplant Institute Act, which I will discuss in the next few slides. So for the comprehensive renal replacement therapy, the important and pertinent articles within this act that I think are important for kidney transplantation is that they specify that patients who are diagnosed with CKD and who undergo dialysis should have a kidney transplant done within 2 years after starting dialysis. This is being pushed. Second is, it is mandatory that all patients with end-stage renal disease or CKD5 are referred to a kidney transplant center. So this is very good because it will initiate the patient's process, and probably eventually the patient will be able to get a transplant surgery. And the third, and very importantly, it outlines the sources that are needed in order to fund the kidney transplant procedure, which is a very important factor and a very important reason why our patients, our CKD patients, do not opt to undergo kidney transplant because they think they will not be able to afford it. Benefits from PhilHealth, from PCSO, and from other important foundations are also outlined in this bill. The Regional Kidney Transplant and Institute Act encourages the establishment of regional transplant centers in each administrative region of the country. So it's like creating an NKTI, only a regional one in each region of the country, which is very good because it will distribute the burden of care and it will probably make it more convenient for the patients. Even if it probably hasn't been passed in law, the transformation of this act has affected the DOH, and in fact, we are going into more specialty centers now in the regions. It's not just for kidney transplant, but for all the other specialty centers like cardiovascular care, cancer. Each region is now being tapped to develop a regional center that can function as an apex medical facility for these very complex diseases. So maybe we will see the fruits of this labor in the next 3 to 5 years. The third important aspect, which my dad was always talking about, is the need for a good organ donation advocacy. We have several groups who are acting on this. We have the Philippine Network for Organ Sharing, or PhilNOS. We were very lucky in Ilocos. I think this was 3 years ago when the PhilNOS visited. We still had no mechanism to develop the kidney transplant infrastructure then, but they were already advocating the development of a network for donors to be able to be screened and to be able to join the network for organ donation. Even if the PhilNOS is usually involved with deceased donors, they still are very active in trying to advocate for living, related, and unrelated donors. NKTI has always been a very important advocate for kidney transplant and organ donation. And a lot of non-government organizations like Regalo, which stands for renal gifts to keep people alive, are very active in advocating that we develop an organized organ donation network and advocating organ donation. There are two important sources of kidneys, okay, living-related and living non-related donors. For most of our kidney transplant procedures, most of the donors are living non-related. At least 70% of them are non-related. It's a good thing we still have good matches and the patients have good outcomes. Only about 4%, 4 to 6% of donations come from deceased donors. So this is an underdeveloped option, and which is something that should be advocated. Our present culture probably will give us some difficulty since people are not used to the idea of deceased organ donation. But it's something that we have to drum up if we want to increase our resources for providing the kidneys that our patients really need. This is a picture of Papa when he was in pre-med. Rog, he doesn't really. I didn't get his flair for good dressing. Very neat. Everything was well ironed. Planchadong buhok. Debonair. He was always like this. He was a very good dresser. But one thing that he never changed in my papa was his dreams, his visions. He kept at them. Throughout his lifetime, he kept at them. He did not stop. And it's something that eventually rubbed off. I hope that I am a chip of the old block, that I can live up to the standards that he set up before. I'd like to share this because I think this quote is this quip from pillar of vascular surgery and transplant surgery in the country is very relevant to the present state of kidney transplantation in the Philippines. And Dr. Ike Ona, also a previous director of the NKTI, and one of my senior mentors at Philippine General Hospital, said that every day, end-stage renal disease patients die waiting for a suitable organ donor. The selfless act of organ donation can save lives. Let us all work together to raise awareness and encourage more Filipinos to give from themselves by signing up to be an organ donor. Sir is still very active in advocating organ donation. He's very active with all the groups, especially the Kidney Foundation of the Philippines. Again, I would like to thank my family for all the support. This is a picture of us when we were still small kids. Ako yung nasa gitna, I'm in the middle. That's my dad right beside my head. That's my sister Joan on his right side, and my brother Kit is on my left. And as our batch saying goes, it's time for us to give back. We have gone through the phases of life. Okay? We have gone through the stage where we take, where we learn. We have gone through the stage where we build up on what we learn when we established our practices. And now it's time for us to share everything that we have developed for our families, for our countrymen, and for all those who need us, especially the CKD patients. So I'd like to thank the batch for allowing me to give this lecture and for highlighting the dreams and visions of my father, Dr. Potenciano Mike Baccay Jr. Thank you very much.
Thank you very much, Mike. That was a very heartwarming lecture for everyone. First off, don't worry about the dressing because you just dress differently from your dad, but it works well. Both of you, it works well for both of you. So the style is there; it's just different. Secondly, I think this is very good for everyone, and also for not just for us, but for those who for those who came after your dad, like our batch and all the other batches in between, we were not able to experience how he worked and the person that he was. So somehow this lecture makes it possible for us to have somehow a glimpse of what your father stood for. And now it comes full circle, and it's your turn now. You're sitting there, and uh, 23 years later, you have the distinction of sitting on the chair, sharing your views as a surgeon, as an and also an advocate for what he advocated to. So maraming salamat, Mike, and for introducing us to what your father stood for. And a short but definitely eye-opening lecture kasi somehow we are couple degrees away from COVID. So for a few minutes we somehow we somehow at least not forget the other medical issues that is hounding everybody else. It's not just COVID. There are a host of other medical issues that we need to address. And this is it. This is where we are now, yung organ transplantation. So it is eye-opening for us, and the lack of organ transplantation affects just as many lives. So if you will, it's very sobering somehow na so many years after your father started it all and his colleagues, parang we are still lagging, and actually the numbers are decreasing dun sa organ transplantation. I have a couple of questions, but to get the elephant out of the room, my first question is, you are a TCVS, you are a TCVS specialist, and somehow I know that you do vascular access, peritoneal dialysis patients, but why the interest in renal care, for that matter?
I think, Rog, it was a serendipity that brought me to Ilocos, because when I came home, I was probably the only one trained to do vascular access for patients. Some of the general surgeons that I met and who are very good friends mentioned that they tried to do the access, but a lot of times they had problems, and they were very happy that someone had come along to take up that responsibility. But you see, the number of patients never dwindles down. It just continuously grows bigger as the years go by, and it was very difficult because I cover an area that stretches lengthwise. If you go along the national highway going south as far as Vegan, from my point of origin is about 50 kilometers, and then going north 40 kilometers, so roughly 100 kilometers radius to reach these patients. And
So that explains why you have so many. You cover such a big area in Ilocos.
yes,
You
because
have to make yourself available to.
there was no one to do it until I encouraged some surgeons to train. So from 2006 until about 2018, I was the only one doing access. It doesn't matter whether the patients were service patients or private patients. They were patients who needed access. And it's not just the access, you have to manage all the complications from prolonged access, because the patients, fortunately, they live longer because of the good and the quality care that is being given nowadays with the advances. So 2018, two surgeons came back. One surgeon I encouraged to undergo TCVS training in Manila, and she came back. The other I encouraged to undergo transplant at NKTI, and she came back too. So we're working together to handle all the CKD patients. But the thing is, each patient is special. Each patient has their own individual problems, and they look up to the doctors that serve them, the nephrologists, the surgeons. They really look up to them for help because sometimes it's very difficult for them. The quality of life is not that good with dialysis. That's why KT is very important because it will improve their quality of life.
Yeah. I guess in your own little way, up there in the north, you're trying to make your own version of a somehow a regional. It's not so much a center, but at least they can access expertise at least with regards to vascular access, etc. So you don't have to wait for a regional NKTI there. You are doing your part already.
Actually, it's up. It's
Oh,
up. We put everything in the process. We have the KT surgeon. We have um, the urologists who already trained in harvest. No, it building blocks pero steady. Basta tuloy-tuloy. As long as it's continuous, eventually we'll get to there. The equipment is ready. We just need a little bit more on the manpower, the transplant anesthesia. Maybe you can refer someone to us. Um, the nephrologists are there. There are a lot of nephrologists now who are taking care of our patients. So the manpower is there. The infrastructure is coming, and
okay.
all we need now is to develop the donation system so that we have the resources to perform the kidney transplant.
Do you actually talk to your patients regarding KT itself?
Yes,
Yung
yes, I do. I tell them,
circumstances around it.
yes, I tell them I'm not a specialist in KT, but you are my patient. You have chronic kidney disease, and remember that the gold standard is always kidney transplant. So we talk about things like finances. I tell them I know a transplant surgeon. You can talk to them about finances. They know a lot of foundations who can help. The important thing is you just have to start the process, because if they are not initiated into the process, they'll always lag behind. They won't go into it by themselves. Hindi nila
And
gagawin.
somehow, yeah, somehow they get connected to the system.
Yes.
The referral is so much easier.
Mhm.
What's the most difficult say CKD cases that you see there? Kasi kung lalo na yung malala yung lugar na very difficult ang access to medical care. And was that the clarion call for advocating KT for your patients?
Yeah.
Yung nakikita mo on a daily
Because
basis?
you see the spectrum. You see them from the point that they start dialysis up to the time that they die. And, blood vessels for hemodialysis or the peritoneal cavity for peritoneal dialysis, they are um, they are not limitless. May hangganan lang kasing ugat, may hangganan din ang tiyan. Pagka hindi na pwede, hindi na sila makapag-dialysis. That's why KT has to be foremost among the options that they should be able to be able to get.
All points lead to KT eventually after you exhaust everything else,
Mhm.
right? Uh, Now I have to ask this, another elephant in the room. A couple of years ago, yung scandal about organ trafficking, uh, it has to be asked na as a developing country, somehow I'm sure there will always be uh, uh, donors that are eligible, but it is so hard to not put a monetary value there when people are on a day-to-day, hand to mouth existence. My the question that needs to be asked is, how can we convince on a national scale, how can we convince people who are hard up in life to actually donate and not traffic their organs? I'm sure it's not easy, but we have to start somewhere. You mentioned legislation and somehow funding through PHIC to the regions. But, mahirap eh. Napakahirap. Kaya naman nangyayari yun. Di naman gusto nila eh. But because there's something there that they could get something out of. That's the monetary value. So, paano natin yun maika-cascade down sa level ng ordinaryong tao na can you donate out of the goodness of your heart and not ask anything for return? Mahirap eh.
Actually, Rog, the answer lies in how we advocate organ donation. Remember that the people who are likely to give organs are the people who will get into accidents or get sick and are stabilized. Sila yung mga potential na donors. But if they have no advance directives to become organ donors, then we will not be able to convince them to give some part of themselves when that time comes. Yung ginagawa kasi sa ibang mga bansa, very active silang mag-advocate ng magbigay ka ng advance directive. If you die, if you're in a car accident, if you get confined in the hospital in the ICU and your condition is bad but your organs are still good, if you give an advance directive that you would like to donate your organs, then that is a good source. That will help replenish the need for lacking organs. It's very difficult in our culture to try to convince living related donors, but it's steadily growing. No, as long as they know that they can live with one kidney, that they can have good lives with only one kidney, then giving the other kidney is something that is an option to them for a relative who needs it. For deceased organ donation, that will follow after everybody else has decided that they're going to fill up their organ donation card, keep it in their pocket, and say, if something happens to me, I want my family to know that I'm willing to donate my organs to someone who needs it. So it's simple, but the problem is getting it out to the public. But we are more technologically savvy now with these virtual workshops, seminars. Getting the message out is easy if we know how to tap the social media and the right people to advocate it. I can probably advocate to my patients, but for someone to advocate organ donation to the general public, it will probably be more successful if an actor and an actress, a VIP, someone who has the intensity to advocate organ donation does it, because people will listen to them. People will listen to people whom they can associate with.
Yeah.
Not just doctors. Kung kasi doktor ang papaanuhin mo, masyadong technical siguro, baka ma-turn off sila. Pero kung a popular person will be the one to do it, and they are knowledgeable enough because you teach them about it, then they could probably be able to help with the advocacy.
Yep. With that, I think we were able to somehow exhaust the discussion. Thank you very much, Mike. It was good. It's almost heartwarming to listen to your lecture. Now, I think the lesson is it's not just COVID out there. There are a host of other issues that we need to discuss and we need to be aware about. And with regards to KT, we need legislation, we need funding, and most importantly, what we just talked about now, we need to educate the population. We need to get the message out there. And there's so much needs to be done so many years after your father and his colleagues started the groundwork for it. So thank you very much, Mike. And it was a well spent evening with you, and best regards to you and Jenny and your family. And any last words, sir?
Well, I'd like to say thank you, pero nandyan si mom.
Oh yeah. So may we now call on the matriarch of the family, Dr. Um, Marieta Carpio Baccay, batch 1964, lovingly known as Dr. Mayet, to represent the family also and listen to what she has to say regarding tonight's memorial lecture and to our speaker for tonight, no other than his son, Dr. Michael Martin Baccay. Dr. Mayet.
Yeah, good evening. Um, I am Marieta Carpio Baccay, the widow of Dr. Potenciano Baccay, and the proud mom of Dr. Michael Baccay. First and foremost, I would like to express my deep appreciation to Manny Ramos, who graciously accepted the task of reminiscing their years in training at the UERM. That was really a public reminiscing. Putting together this video presentation is really a labor of love and commitment. So I would like to especially thank Dr. Badilla and the whole group. Dr. Badilla, because of his introduction of Mike, which, you know,
Dr. Badillo.
is that his name?
Dr. Badillo po.
Dr. Badillo.
Badillo. Thank you, and I love you, Mike, for all the work and additional waking hours, and for giving me or giving us the additional surprise info that I heard this afternoon. You see, much of your waking life was in school. From the moment we went to school and we were working, after that, you went to the US for your college studies. So I think they know more of you than I do. I know as a baby, I know you as a baby, but that's about all. Before I forget, I want to thank the graduating class, the working groups, Dr. Irastorza and the Alumni organization for this gift that keeps on giving, so they say. We are able to publicly reminisce the life and the life of my husband because of this yearly activity. Mike must be smiling down and proud and pleased of his firstborn, whom he last saw when he was 18, when he left for the States. He died a few months after, I think, the school opened in Minnesota. They shared some traits. There were some traits that they shared. One of these is focused energy, parenthesis, passion for whatever they were doing, coupled with the ability to adjust, to change, whether big or small, whether it be in the workplace or at home. They were both willing to teach. In fact, I think after they're done with clinics, they would be more in academia. They're both they both have foresight and timeliness. However, as you all said, there's a difference between the first generation Mike Baccay and the second generation Michael Baccay. He said he's a chip of the old block. I think he's a better chip of the old block. My husband had flair, the good definition of flamboyance. He dressed well. The Dean Sanchez used to say, Mayat, yung asawa mo parang galing sa cover ng magazine. Ikaw naman mukhang galing sa farm, you know. Which means I'm more like Michael. However, your classmate can also dance. He can also sing, and he can also drink. Oh, I'm sorry. He can also carry his drink. But he's very unassuming. He's not shy, but he's not. One gets to like him after a while. He grows on you. You could say that. So both different people, different persona, but they have the same visions. And I'm glad that I'm really, what I told Ida was, I'm excited, I'm kinikilig, and I'm grateful that the class, your classmates, wanted you to be the memorial speaker. The previous years, they had asked me for whom to invite, and I had already prepared a lineup, not remembering that it was my son who was a celebrant. Thank you very much, and thank you to UERM again and the Alumni Association, and to the class, the jubilarian or silver jubilarians of UE. Good evening.
Thank you very much.
Okay naman.
Dora, opo, salamat po ng marami. Now we know who Mike is and who Michael is. Finally, nakilala na namin. We're not confused anymore who Mike and Michael are.
Thank you, Dr. Badillo.
Thank you po,
Badillo.
ma'am.
Yeah, Badillo.
Badilyo.
Tensya ka na, matanda na ako eh.
Kami rin po, matanda na.
Oo nga din eh.
Salamat, Doktora.
Thank you.
So
Bye-bye.
nice to see you po. Right now, I just want to read up from the plaque of appreciation that we will be awarding to our speaker tonight, Mike. Plaque of appreciation from the University of the East, Ramos Memorial Medical Center, Incorporated, College of Medicine Alumni Association, Incorporated, the 51st Annual Alumni Homecoming Usapang Buhay Doktor Webcast Series awards is plaque of appreciation to Michael Martin C. Baccay, MD, of the UERMCMAAI Medicine Class of 1996, a speaker during the 23rd Dr. Potenciano Baccay Jr. Memorial Lecture, today, March 10, 2021. Signed, Elmer Jose Meseda, MD, Chair of the Scientific Committee, Homecoming 2021, our batchmate, and President of the UERM College of Medicine Alumni Association, Dr. Samuel Vincent G. Rastorsa. Thank you, Mike, for gracing tonight's festivities.
Thank you, Roger. Thank you to all our batchmates and greeting to all those who are also celebrating their reunions in their anniversaries.
Thank you, everyone. We hope we were able to get some pearls regarding spreading the gospel of organ transplantation. It's not in the back burner. We have to get it out in the open, and for people to become aware of it, that there's so much need for it, so much more now than even before. Um, for our closing remarks, may we now call on the Dean of the College of Medicine of the UERMCMAAI, our beloved, our very own Dr. Norbert Lingling Uy, MD, Batch 1979. Good evening, sir.
On behalf of the college and the administration, I would like to thank our Alumni Association through its president, Dr. Samuel Irastorza, and the Silver Jubilarians, Batch 96, for once more helping us reminisce the vision of Dr. Potenciano Baccay. Like his father, Dr. Michael Baccay is a trailblazer of hope for people with chronic kidney disease who are living in the northern part of our country. His advocacy for renal transplants is laudable. We wish him success, and we hope that his advocacy will be insulated from the interference of people whose main goal is to take advantage of others' sickness or poverty. Thank you to all who have made this year's Dr. Potenciano Baccay Memorial Lecture possible. Thank you to the family of Dr. Baccay, to Dr. Marieta Baccay for gracing this occasion. Thank you to all of you who attended this virtual memorial lecture.
Thank you very much, sir. And with that, on behalf of the celebrating classes, not just of our batch 1996, but all of the other celebrating batches, we would like to thank everyone for sharing with us your precious time tonight. And we hope to have been able to somehow give you some pearls about what else needs to be learned out there. Not just COVID, but there's so much more. And for tonight, it was the advocacy on organ transplantation. Thank you very much to our guests tonight, Dr. Mayet, Dr. Uy, Dr. Ramos, and our very own Dr. Mike Baccay, the other Mike. So with that, good evening and thank you very much.
That was truly a memorable and touching memorial lecture. Thank you, Mike, and thank you, Roger. Now we have come to another interesting part of this session entitled The Medical Education and Training in the New Normal. Along with COVID-19 came the new way of virtual learning. I guess every alumnus is interested to know how our colleagues in the academe are coping with this new system in this challenging time. I am honored to be given the task of introducing our esteemed speaker for this session. Our speaker is a member of Batch 79 of UERMMC. He was the chief resident of the Department of Medicine in 1984. After that, he had his fellowship in adult cardiology at the Philippine Heart Center for Asia. He then went to St. Louis University School of Medicine, Missouri, USA, for his research fellowship in cardiology. He has master's degree in public health as well as education management. As an academician, he received numerous distinguished teachers' awards. He was even voted as the best teaching male consultant in 2020. At present, he holds the following positions: Professor of Medicine, Department of Medicine, UERM College of Medicine; Chairman Emeritus, Mary Johnston Hospital, Department of Medicine; Chairman, Joint Committee on Accreditation and Certification, Philippine Society of Echocardiography; Chairman, Accreditation Subcommittee of Specialty Board of Adult Cardiology, Philippine Heart Association. Consultant at UERMMC, Philippine Heart Center, and Heart Institute of St. Luke's Medical Center. He has been in the forefront of leading medical organizations in the country and has published and presented numerous studies and drug trials. I'm also privileged and grateful that 25 years ago, my batchmates and I were in his class. Presenting to you, Dean of the College of Medicine, Dr. Norberto Lingling Uy. Dean Uy will be joined by two of my batchmates in the academe after his lecture. Dr. Imelda Dizon Rivera is an associate professor and chairman at the UERMCMAAI Department of Anatomy. She is an associate pathologist at UERMCMAAI. She is also a counselor at the Philippine Society of Anatomists, a member of Philippine Society of Pathologists and Philippine Association of Medical Technologies. Dr. Lourdes Bernadette Sumpayco Tanchanco is an associate professor and director of research and innovation at the Ateneo School of Medicine and Public Health. She is a developmental behavioral pediatrician at the Medical City and the MedMom. She is also the PRO and Board of Trustees at the Philippine Society for Developmental and Behavioral Pediatric. The moderator for this session is our hardworking batch chairman, Dr. Rodney Jimenez. Rodney is also in the academe as an assistant professor at the UERM College of Medicine. He is also director of the Philippine Heart Association Board and an interventional cardiologist at St. Luke's Medical Center, Global City, and Quezon City. Now, the screen is yours, Rodney.
Good evening, everyone. I'm Dr. Rodney Jimenez, and I'm one of the members of the class of 96 of UERM College of Medicine. Right tonight, we will be discussing the medical education, the new normal or the better normal. Because as we all know, we have all been experiencing teaching or education, and we were pushed by these difficult times through the digital era. So medyo bumilis yung ating era to digitalization. So with me is a great mentor of mine during my residency training at UERM Hospital in internal medicine. Right now, he's the Dean of the College of Medicine of UERM. Let me introduce to you, please welcome Dr. Norbert Lingling Uy. Sir?
Hi, good evening, Rodney, and good evening, everybody. Thank you for the invitation. And it's really a very opportunity for us to share how we are trying or how we have tried to make better our medical education at UERM.
So, Dean, let's have a seat for a discussion. And we're back. Along with me, to discuss about their experience experiences during this pandemic with regard to education and probably research, are my classmates. Si Dr. TP and Dr. Mel. They were already introduced to us by Jing. TP is the head of the Ateneo School of Medicine and Public Health Research and Innovation, and Dr. Mel is the chairman of the anatomy department of the UERM College of Medicine. So welcome TP and welcome Mel. Hello. Kaway. Appear. Appear.
Appear, diba?
Appear, ayan. Appear, Mel. Okay. Yan, okay. Okay, so let's go and let's start with the questions. So questions, we gathered some questions from our classmates and from Some of our classmates kasi are parents already of the students, sir. So may mga bata pa lang sila and maaga na. Kaya meron na silang medicine students. So first questions, what were the challenges for the medical school during this difficult time, sir?
I'm sure all of the medical schools experienced the same thing that we did. The announcement came so sudden, and everybody was unprepared. Okay. So after securing the safety of our students, we face at least 3 challenges. Number one is engendering the adaptation of our students, faculty, and the parents to the new normal. We had to introduce a lot of changes. We went into remote learning, and so everybody has to adapt to this. The faculty not only in delivering the curriculum, but in innovating how to deliver the curriculum more effectively, and the students accepting the remote learning modality. So that's one. The second challenge, of course, is the so-called equity, trying to put a system that is going to be fair to everybody, particularly the students. Internet access to internet, Wi-Fi, and all those are very important. Of course, many families were also affected, their financial standing, and so that is also another challenge that we had to settle. And of course, the last one is how to get the community involved in all the efforts that we did in order to minimize the effect of the pandemic. So they say that in order to produce one doctor, it usually takes a community. So the school, the family, the students, the faculty, and all those have to be one and help us push our curriculum.
Thank you, sir. TP, what about you?
Yes.
What were the challenges for your school? Ano yung mga na-experience nyo?
Tama. Sige. Ako, I agree with Doc Lingling, no? Parang, I agree with the 3 categories that you mentioned, sir. So, yun nga, yung shift from face-to-face to online, that was a big move for us. Siguro maswerte din po kami because the university was actually very supportive. So, hindi lang siya effort ng med school. That was what happened in our case. So, meron kaming Ateneo Blue Cloud na yung buong university with the different campuses nationwide. Nag-train po ng teachers para makagawa ng mga courses, ma-shift yung curriculum. Pero syempre, ito, ewan ko, Doc Lingling, pero sa amin ang challenge din is how do you now choose what to bring online? Kasi hindi naman pwede na lahat ng tinuturo mo during face-to-face. Malapapasok mo sa online medium, di ba? Tama ba, Rodney? Ganun din sa inyo?
Kasi parang, kasi yung online could go across different society or different platforms, di ba? Baka cross siya doon, maging hindi pala pwede, no? Prohibit yung pwedeng i-bigay. So, sir.
Ang kagandahan sa UERM, at least dahil beforehand, talagang we were very, very clear with our program objectives.
Right.
We were very, very clear. And we, in fact, we were already ready to, before the pandemic, to deliver our curriculum the traditional way. So nung nagkaroon ng pandemic, all we had to do was to find out what is the most appropriate equivalent learning activities to replace some of our traditional practices.
Ikaw, Mel, lalo na sa anatomy, what were your challenges? Paano mo ipapakita yung anatomy ng wala ng cadaver, di ba?
Yes, very hard. Sobrang, it's dinescribe ko sa sarili ko, H, headache and heartache. Pareho. Headache kasi, how can you teach anatomy without cadavers? And together along with not only the skills, also, hindi lang cognitive, pati yung the hidden curriculum that goes along with cadaver dissection. So it's really very hard, and it's not comparable as in you're just looking at or watching videos. Students still clamor for to dissect a cadaver, yung a real cadaver, than just watching a video.
I agree with Mel, no, that there are several aspects ng ating learning na medyo hindi natin ma-deliver sa online. So merong mga aspeto na nawawala. For example, yung mga hidden curriculum, yung psychomotor aspect ng learning ng ating students. The cognitive part, yung domain is mas madali, but yung psychomotor yun ang pinaka affected.
Yeah, I agree. PP.
Yung mga skills, ano po, Doc, actually, that's why for the longest time, talagang tinatry din, and I'm sure through APMC din po, di ba, Doc, na magkaroon agad ng face-to-face, no? Pero siguro, what I also wanted to mention was that makakatuwa din that our medical schools were able to shift into this new platform, and nakita po natin how innovative our teachers are. Kasi kumbaga doble talaga yung trabaho ng teacher and yung faculty na yung effort that they put in at the same time supporting their students. Kasi ang dami rin mental health problems at this time, di ba? Hindi lang estudyante, pati faculty and admin and staff. So I think especially kayo, Doc, you're also with the administration of the schools. I'm sure that's also something that you encountered before.
You mentioned earlier the support of the administration is very important.
Yes.
And just like you, we are also lucky na yung administration namin is very, very supportive.
Sir, kwento nyo nga yung, di ba, March 15 nag-lockdown. Tapos, hindi pa tapos yung class nun, di ba? Tama ba?
Yes.
So, paano nangyari yun, sir?
So, we thought all the while it was going to be a short vacation for our students. And I think the students did not realize the significance of the lockdown, of the pandemic, because 2 or 3 days later, I think we heard some news that some of our students were in the beach, and so I had to call them back and really told them that this is a serious problem, and in fact, I threatened them that if we find somebody out there, they will be sanctioned.
Yeah, I remember that,
Yes.
sir. Marami nag-post na nasa beach sila habang naka-lockdown.
They did not realize. Okay. But then after 1 week, it seems that we actually realized that this is not going to be 2 or 3 month affair, but this is going to last longer than. In fact, I told the faculty that we have to prepare for a 1 year or even 2 years of pandemic.
Hindi, sir. Halimbawa, di ba, March 15, tapos paano naging online lahat? Naging online automatic?
Yeah, swerte tayo. I think
TP.
si TP sa kanilang university, they have also learning management system, LMS.
That's it.
And swerte lang tayo because a year or 2 before this, we went into Canvas. And so we were able to deliver our curriculum sa Canvas. In fact, we were testing our students, giving them assignments to the Canvas. So it was so easy for us.
So, TP kayo rin ba? Canvas din ba ang inyong learning management system?
Yung learning platform, learning management system. Nung nagtapos yung school year kasi, hindi pa po kami Canvas. Although there were preparations, iba-iba kasi yung sa iba-ibang units ng university. So yung iba nag-Google Classroom pa, yung iba blackboard, so iba-iba pa depending on the unit. Swerte rin siguro medyo patapos na yung school year nung nangyari yung lockdown kasi that gave us summer to really prepare and to consolidate. And then that was when the shift to Canvas happened for all of us. Pero syempre, learning curve, then siguro ang maganda lang about the pandemic was that it expedited the shift to online learning. Kasi dati parang, okay, nandyan lang siya in the works. Some faculty would try it out, would have quizzes online, ginagawa nila. Pero ngayon, biglang, lahat tayo, ito yung gagawin natin. So sabay-sabay na nag-aral using the new platform.
Totoo yan, TP. Well, we were using Canvas siguro mga 30 to 40% lang before the pandemic. And once the pandemic came, talagang full blast yung aming Canvas.
Okay, Mel. Ikaw naman, how was your experience with the LMS? With the Canvas? No? Or kwento mo sa amin yung na nag-lockdown, paano ginawa ninyo? Paano yung mga written exam nyo? Bigla nyo naging online lahat, no? At yung anatomy.
Okay.
Finals, di ba? Yung finals, di ba may cadaver?
Parang, oo, dapat may cadaver finals, cadaver practical exam. So before that, when we went into lockdown, okay, it didn't sink agad na it will be for a long time. So we prepared for the rest of the school year. I was not yet the chair of the department then. So we recorded the lectures, prepared images from the net. Okay, so because wala pa kaming resources talaga for cadavers, yung mga pictures. So we just search the net and look for educational sites where we can acquire those histologic and cadaveric pictures. So yun yung ginamit namin for teaching and for the practical exam. So all are from the internet, actually.
Hindi nila na-experience yung yung hirap ng practical exam ng anatomy.
Oo nga sabi ko nga kasi this school year, yung mga students, they want to see a real cadaver. Okay, kasi the learning experience is more, you learn more when you use the 5 senses, diba? Vision, audio, touch, and smell. So they were not able to to know what's the real smell of a cadaver.
Ano lang ba? Lang ba, sir, yung parang may ganitong problem na wala akong maisip eh. Of course, syempre yung interview with the
physiology, we got some resources. We were able to subscribe to some form of resources in physiology, lalo na yung laboratories. And then yung biochemistry, they produce their own. And of course, sa anatomy, we were able to get the grants, dissection.
Grants Anatomy Lab, sir. Grants Anatomy Lab.
Yung anatomage is different. This one,
it's different.
We subscribe for each individual student. So, yun ang advantage nito is bawat isang estudyante, they can access the grants dissection atlas,
Mm-hmm.
And
yes, sir. Atlas and videos of dissection.
Ano yung program na parang gaganin mo lang, nadadissect mo na yung
anatomage.
Anatomage.
High-tech na.
There are two kinds of dalawang brands yata diyan.
Nakita ko yun sa internet. Actually, ang experience ko naman as a teacher, dun sa Canvas, matagal na pala yung Canvas. Hindi ko alam, sir. Pasensya na po. Tapos ngayon lang ako nag-open. Parang recent lang na talagang ni-require kami last year lang na to activate the Canvas. Kasi nandun na pala, siyempre pag open ko, lahat ng ang dami na palang mails na tinuturo na pala yung Canvas before. So, may fault din kami na hindi namin natutunan to. Pero yun nga, itong pandemic na to, na-push lahat ng mga mentors or faculty to learn the digital way of teaching the students. Okay.
Isa yun sa mga sinasabi kong adaptation na kailangan gusto namin mangyari sa faculty.
Ang isa kong nakikitang problem ay, siyempre alam naman natin lahat ito, na pag dumating ng second year, tsaka third year, na supposedly we have to have encounters with the patient, interviewing and doing physical examination. Paano yun, sir?
As I said kanina, yung masyadong affected na aspect ng ating learning is the psychomotor. And these are the subjects na kailangan nila talaga ng face-to-face interaction with patients. And then meron silang dapat mga movements like auscultation, palpation, yung mga ganyan. So yan ang pinakamalaking affected because we shifted to a virtual demonstration. So they see the picture that but then we never experienced doing it.
Kayo, TP, meron din ba kayong anong insight mo doon sa
Kagaya ng sinabi ni Dean Lingling, no? Parang, we shifted to mga demonstrations online. Pero agree po with skills, yun yung nagkulang talaga. And the move of our university, our med school, is actually towards simulation labs. So ngayon po, yun yung next project ng dean namin, to acquire those models and those, parang yun nga po yung gagamitin for simulation. Kasi napo-foresee din na yung clinical exposure will really be limited. So kaya po, pino-force din na mag-start na, di ba, parang there was this big move and actually the students were also parang excited to resume kahit na partial face-to-face. Kasi kailangan nila yung skills. So we wanted to create medyo controlled environment. So you have to choose saan sila pwede mag-rotate. Siyempre wala yung mga COVID wards, no? But unti-unti, bumabalik na yung mga face-to-face encounters with patients.
Totoo yan, TP, kasi talagang even yung mga mannequins namin, yung mga simulated, because the students were not allowed to come back to the school. So our skills laboratories were also closed. Even if we have all those mannequins, we could not expose our students. So we really worked very, very hard to get the permit for limited face-to-face student exposure to our patients, and we're happy that just this week we were given our permit by the CHED. Okay.
Ano yung mga nakakatawang experience ninyo or yung mga challenges na na-experience during sir, di ba nag-preceptorial ka rin? Tama ba, sir?
Yeah.
O aside from administration job, nag-aano ka rin, sir, naghahawak na student?
Yung shift namin sa mga preceptorial, ang shift sa aming emphasis is concept clarification, concept understanding, concept application, problem solving, and decision making. So mostly, you can give them theoretical cases and then they exercise on that. So cognitive, maganda, pero psychomotor, as I said, yun ang wala.
Okay. Ikaw, Mel, meron ka ba experience on that? Ang preceptorial na walang patients, siyempre aside from walang cadaver. Are you also handling, Mel, na aside from anatomy, preceptorials, supposedly?
No, anatomy laboratory. Okay, so it's really just a discussion of the structures during lab since wala namang cadaver, and watching the videos and clarifying clinically important structures, surgically and clinically important structures when we do our laboratory. And of course, the students were given those materials a week ahead, so they are able to study, scan the materials before we go into lab. So they form their own discussion group also. They plan what to discuss, and we're just there to facilitate their discussion.
Yeah, ang limitation dyan, Rodney, sa ginawa natin is that most of the information, data are being supplied to the students. And then they just find out the significance of this data, paano nila magagamit sa problem solving nila and decision making. But the important aspect na nawala is yung the student himself eliciting the data from the patient, getting the data from the patient.
From true patients,
Yes.
no? Kasi alam ko sa medicine, no,
Yes.
as a preceptor, we act as patients, no? Pero iba pa rin kasi parang di ba
Tunay.
nakakatawa minsan isipin ano nga bang dapat kong sakit ngayong araw na to, parang ganun, para malaman ng ganun din ba sa inyo TP nag-act kayo as patient?
Oo, minsan parang kami yung simulated patients. Lalo na ngayon, actually si Martini, one of our batchmates, heads what we call yung clinical encounter. It's actually a module for third year medical students in Ateneo. Tapos medyo ano lang, yung last session namin parang ang instruction din is be creative. Be creative ang instruction sa faculty kasi paano mo ipapakita ang clinical encounter when everything is virtual. So iba-ibang style talaga. Yung iba pretended to be patients, yung iba had an actual patient in their clinic, so parang telecon for the students. So parang okay, lumalabas din talaga yung creativity ng faculty.
Yes, sobra. As in parang minsan wala naman doon sa binigay nilang module na dapat ganito yung itsura ng patient o dapat ganito yung sexual activity ng patient. Siyempre, tatanungin sa'yo, pwede po ba kami magtanong kung ilang beses po kayo? Ganon?
Tinay ko po, paano mo sinasagot yan? Sige nga, sample ng sagot.
Yung mga model ng pasyente, mahirap yun. Alam mo, they have to learn, ano? They have to be taught how to do that. So, they have to be trained. Okay? Kaya medyo hindi kasing ganda kaysa tunay na pasyente. Kasi sa tunay na pasyente, nandyan yung skills ng estudyante to elicit the essential information. And sometimes the patient cannot say this in exactly what you want, how you would like it said. You know?
Tsaka yung experience natin, sir, na halimbawa, ayaw ng patient i-reveal sa iyo yung information, tapos yung skill na pangungulit ng sa patient or yung paggalit yung pasyente, paano mo siya papakalmahin, yung mga ganun, yun yung parang kulang.
Yung training na ganyan hindi maibigay sa inyo ng pasyente ang gusto mong impormasyon.
Correct.
And then you become so impatient. How do you control
yes. Yun yung siguro isa sa mga sa parang anong aspect yan, psychomotor.
Yeah.
Na talagang medyo kulang.
Very, very important.
So dapat parang humabol at the moment ngayon napapasok na sila.
And that is why the APMC said that they will not graduate any student if they are not given 6 months of encounter with patients, which is very, very
okay naman siya.
Important.
Kailangan. Kayo, TP Mel, meron ba kayong mga experience on other challenges nowadays?
Siguro, parang part of what and I think Mel mentioned this kanina, yung hidden curriculum din. Parang how do you impart that to students knowing that virtual, lahat ng encounters. That was But one thing siguro that I wanted to share was that it was also during this time when nakita natin yung community banding together. Na hindi lang siya because of curriculum that needed to be developed, but it was or delivered. It was also because may pangangailangan yung buong community that extends beyond school. And nakita, okay, people stepping up, tulong, pati ultimo yung mga guards, yung mga maintenance, parang kasama sila na nakita mo students, faculty, parang lahat tulong-tulong towards bayanihan. Parang ganun talaga yung lumabas din during this time. And that's very heartwarming.
Yeah, importante yung participation ng the students in making the process successful. No?
Yes.
We try to meet our students as regularly as we can. So from time to time, meron kaming town hall discussion. So pag sinabi nila they have some problem, we call them for a town hall discussion and then let them express anong problems, yung kanilang suggested solution, and then we meet halfway.
Yeah. Kami rin, ganun
nice.
din yung ginawa namin. And that was very helpful. Kasi lalo na nung sa start, na nangangapa lahat. No one knew what was happening, and the fact na at least yung Decano, and I'm sure yung UERM students also appreciate that. Knowing that the dean is at the helm of things, knowing na siya yung magdidirect sa atin towards this shared direction, that was actually very helpful for everyone.
That's true. That's true. Yung leader, men.
Yeah. I would like to thank Dr. Uy because of his dedication. Talagang every now and then he meets with the student and asks how they are, and yun nga, to solve if there's a problem, to solve the problem with them. Kasi gano'n naman yung curriculum, you have to include everybody, the administration, students, faculty, the dean, other staff of the college. And one thing na I think nahirapan ako is to build a relationship with the student, yung true relationship with the student, teacher-student relationship, because it's hard to form something with someone just seeing them sa screen. Diba? Parang ang hirap mag-build ng trust.
Parang kausap mo na.
Oo, parang it's not real. The students are real, pero parang hindi, because hindi tayo sanay, di ba? We're not used to this. We form a friendship because we see them every day. We know how they feel. We know how they will react to something na sasabihin mo. But ngayon, parang naka-close nga yung mga videos nila, di ba? When you conduct class. So we really cannot tell what are they feeling. Anong yun, sir. Di ba, sir?
Yung interaction with the students is really enriching, enriching. Naging sensitive yung school sa mga pangangailangan ng mga estudyante. Sometimes akala natin na napakasimple yung bagay, pero yung pala para sa kanila medyo malalim na yun. Okay? So we tried to be very, very sensitive, lalo na yung mga students namin who are in far places. They were affected by the typhoon, So we tried to find out kung ano ang problema nila. So ngayon, natuto na rin ang estudyante natin mag-articulate ng kanilang needs at problems properly. Alam mo, dati, you know that I must have answered more than 5 complaints filed against the Commission on Higher Education. At first, they want everything is stopped. They don't like any exam. They don't like any exam. They want the grades all passed. So yung mga ganyan. And then of course our students going to the social media and then venting So we taught them how to behave properly and to be more mature and to bring their problem to the proper person that can address their problem. Sabi ko, if you go to the social media, kahit na magalit yung publiko sa amin,
That's
wala
true.
din mangyayari. Pero if you come and approach us and you tell us your problem, then probably we can solve your problem. So ayan, alam mo, very productive. So ngayon ang ating mga estudyante, they don't resort to social media. They come, they write us. And one thing we did was every single letter that the student write to us, we answered them. So,
wow.
Walang sulat na unanswered.
Wow. Grabe, sir, yung nyo.
Even the parents.
Actually, yung tatanong ko, ano yung mga experiences nyo with the students? Ano yung mga particular challenges with the students? Or meron ba kayong perspective ng mga students, feelings? Ano yung nararamdaman nila with regard to this kind of education right now?
Yeah, very funny. Isang ko sa reception ko sa mga estudyante na sometimes the problem ay hindi actually personal na problem nila, but it's the problem of their friend. So sabi ko, yung nagtutorment sa kanila is really a vicarious anxiety for somebody. Alam mo, ang sabi ko sa kanila, you tell me kung ano ang personal problem that you are encountering. Usually they would write me na, well, as far as I'm concerned, wala naman akong concern sa internet connectivity, but I'm worried about my friend.
I know na nakita ko ngayon sa social media nung bagyo lalo, di ba?
Yes.
Na wala nang internet yung iba. Na, ano nga ba yun? May hashtag sila dyan na
Walang iwanan.
walang iwanan. Oo. Did you any experience on that? And then?
Kami feel namin yun. Kasi di ba ang Ateneo, double degree pa yung mga estudyante. So aside from their MD course, meron din silang yung MBA. So nung start ng school year, doon usually ni-run yung MBA. So talagang marami rin po kaming mga reklamo na narinig kasi nga naninibago din lahat. But what also helped us is that meron kaming mentoring and coaching na kasama sa curriculum namin. So it's a regular time, there's a regular time that's set and it's curricular. So merong mga mentors who will journey with students, and that was actually a very helpful platform for a faculty member or a mentor or coach to get to know the students and to hear their concerns. So yung iba nga, yon. So syempre yung concern, tama kayo Doc, yung concern for this classmate na nasa Mindanao, kaya pati sila hindi na nag-online kasi nakikiramay. Natatandaan niyo yung may time na ganyan na gusto nila mag-strike daw lahat para magkaroon ng academic freeze. Merong panahon na medyo nauso yun eh. Pero sa awa ng Diyos na nakausap, I think ang secret po talaga is communication, di ba? And having those lines of communication available to both or to everyone, pati all the stakeholders po when it comes to medical education.
Alam mo, Tipe, yung nabanggit ninyong mentoring program, kami, inano din namin yung mentoring program. And in fact, we involved some of the students na medyo mas mabilis na nakapag-adjust. We made them part of the mentoring program. Yeah. So, nandun sila. They, in fact, mentor yung younger, lower years nila. So, malaking tulong.
Ikaw, Mel, meron ka ba na experience na kinausap na student, wag na nga kayo magaganyan?
Madami. And madami din silang complaints in the first semester because in anatomy, di ba, kasi sir, we rearrange the sequence of the topics and nahirapan sila with that nauna yung neuroanatomy. After histology, then neuroanatomy. So they were complaining about that. Then we set a meeting with each section, one session for each section. Then we talk with the students and to explain and clarify na why was it rearranged. There's a purpose for all of this why we changed the approach in teaching anatomy in the curriculum. So they were able to understand naman, okay, and ever since the communication lines are always open with the students in anatomy, and we also assign anatomy advisor. So aside from the college mentors, may anatomy advisors that will help them with. Alam naman natin, anatomy is a difficult subject. Well, ngayon, yun ang difficult subject for them. So, we assign advisors.
Totoo yung sinabi ni Mel, na isa sa pinakamalaking resistance from the students is their inability to see the why in what we are doing. Okay? And the moment we are able to explain to them why we are doing this, mukhang okay naman sa kanila. They would eventually understand. But I think, tama yun. Sa lahat ng nakikita kong problema, it's because we failed to explain the why we are doing this. So they would write us, why are you doing this?
Parang ano lang naman yan. Naalala ko talaga yun. Bagyo yun, di ba? TP na
Mm.
parang may blackout sa iba-ibang mga regions. Tapos freeze, academic freeze. Hashtag
Yeah,
academic.
oo.
Hashtag walang iwanan.
Walang
Ano? So
Mm-mm.
marami kayo nakausap, sir, ng mga hindi lang individuals. So pati ba yung mga council, ng student
Yeah.
council?
The student council sa UERM is very, very active.
Yeah.
For mga issues lahat, they would take that up with us. And then, so in fact, sa karamihan ng mga committees namin, we would involve the student council.
Tama.
Okay.
Kami rin, ganun. Kasi important yung feedback ng students. Kasi di ba we want constant feedback because this is something that's new to all of us. So it makes the curriculum delivery more dynamic or we receive feedback. Kaya pwede natin, kumbaga, important lang din yung openness on both sides. Di ba? We get the students on board.
Alam mo, TP,
Opo.
bawat lecture namin, bawat encounter ng students with the faculty is always they are asked to write some assessment of the
Yes.
encounter.
Tama.
So, and we review all of those
Right.
yung nilang encounter, and we get we call the attention of some faculty kung medyo they're not addressing certain aspect of the learning areas ng mga bata.
Right. I agree. Actually, evaluation is very important. Kaya nga po, well, aside from yung mga summative evaluations natin in the end, di ba, important din yung formative evaluations that are continuously being delivered or tuloy-tuloy po yan for all year levels. And I think we need to pay very special attention to that because that's also one way how we can improve given na ito na nga po ang ating better normal.
Yeah. That's what yun yung outcome-based learning, no? Yung dapat maraming beses yung formative learning, no? So before you can do the summative learning. We'll entertain some questions from our classmates, so or comments here. So here is from Dr. Elmer Jose Meseda or Edjam or Ejam, my classmate, no? In many ways, the pandemic has presented challenges to medical education or training, but it has also presented avenues for us to improve. What are the things or avenues for learning have you realized that you can improve on in the framework of the admin and as a faculty?
Alam niyo, dati we deliver our lectures talagang face-to-face. And our students would be asleep after 15 minutes to 30 minutes. Now the lectures are pwede nang asynchronous. They can access your lecture anytime. So if they feel sleepy, they can stop. And once they are energized, they can go back. So that's one thing. And then, so we're making that very, very strong because that is going to remain with us even after the pandemic.
Yeah.
I understand that in the United States, many universities are not actually giving lectures anymore, classroom lectures. The students would go to the library and select the topic that they want to learn. And the encounter that they have with the faculty are just talagang interactive encounter. And that is what I want to push in our university.
Kaya pala magsasabit muna kami ng lectures.
Yes.
Annotated lectures. And then on the time of at the time of the lecture hour namin,
we encourage you to have a case-based discussion.
Discussions na question. Kay TP, ganun din?
Yes, I think ang isang maganda rin about what the situation right now is we were able to explore different teaching learning activities.
Yeah.
And ang isang maganda rin dito, we were now really kumbaga compelled to look at technology and to use it to our advantage. Diba kasi marami sa atin takot. Like, diba, hindi naman tayo digital natives eh. Yung generation natin, matatanda na tayo, mga batchmates ko, kumbaga hindi second nature sa atin ang gumamit ng technology, kagaya ng mga estudyante natin ngayon, ano. Pero nakita mo, nag-try pa rin gumamit ng Padlet. Ngayon ang tinatry namin is yung Respondos para to make sure na nabawasan yung cheating in school. So meron tayo ngayong may mga apps na rin na ginagamit na Okay, ito pala effective. Or halimbawa, pati use of Prezi videos to record your lectures. Parang dati wala yun sa vocabulary natin. Ngayon, nandun na siya. And it's a tool that we can use to our advantage to impart learning.
That's true. That's true.
Yes. At first kasi there's hesitation, like what TP said. Kasi nga, we are not techie. Okay? We are from, ano lang tayo, migrants eh. We're not natives nga. So there's hesitation. That's why may delay tayo sa UE paggamit ng Canvas. Diba, Rodney? So, may hesitation. So, ngayon, this pandemic, it's an advantage in the sense that we were forced to use all of these technologies that we were afraid to use. So okay naman pala. So it's for improvement of delivering the curriculum. Improvement siya talaga. And after the pandemic, yun nga, we can go into blended learning. So will not take up much time in the classroom. And I think that's a better way for medicine, improvement in the education.
The term that was used by Mel is force. We were forced. You know? I think tama yun eh. We were so afraid, both the faculty, the students, we were so afraid to embrace new things, changes, because sa tingin natin, the traditional way of doing things is already working. You know?
Yeah.
So now we were forced to reflect on what we are doing, find meaning in what we are doing, put meaning into what we are doing. So I think everything is improving. That this is one side of the good side of the pandemic, even if we don't like the pandemic.
Actually, nung pandemic, dun din ako natuto on looking for online courses, no? Especially with regard to my specialty. So, o kaya nung time na I'm entering COVID wards or COVID ICU, I relearned how to use IMEC vent or how to adjust mechanical ventilators na sa online din yun. So, that is asynchronous, di ba? Sir, example of asynchronous. Okay. Meron pa rito from Dr. Shira Rector Brown, my class of Shira. As you try to improve on this, now with the limited face-to-face, would you employ this new normal? Or even after we get through the pandemic somehow, since there are things like lecture that can be done in the comfort of your own.
As I said earlier, we will have to retain, or many of the things that we have learned during the pandemic will stay with us. And I think they have enhanced, improved our way of delivering our curriculum.
Yeah. Ako, I agree. Important lang siguro kasi our North Star should be our learning objectives. Yun lang naman talaga yun eh. Na regardless of method, if we think it's a good methodology, then we will keep it. But if we feel that it's not helping us achieve our learning objectives, then yun, baka we need to revisit and we might need to revert to what we've been doing before.
Agree 100% with TP.
For Dr. Uy, since this is also a venue for the alumni to extend help. Okay. Talaga. If they want and can, what does URM need that maybe the alumni can help out on?
Well, one thing I mentioned earlier, yung equity, you know, and one of the problem that came together with this pandemic is that many of our students' their families, yung kanilang financial
That's true.
standing talagang nasira. Okay? In fact, itong semester na ito, there were about 80 students withdrew from the school. Most of these, of course, mga mental problem due to anxiety at saka depression. But a substantial of those who stopped studying is because the family cannot sustain. And this is not something that we were able to easily address immediately, you know. But I'm happy to tell everybody that I proposed a scheme to the administration, which the administration in principle has already approved. Na I will raise money from the alumni, and then whatever money I will be able to raise, tatapatan daw ng administration. We will make this money available to the student loan. So that hindi siya maubos. Kasi alam mo, the cost of education is going up. The cost of living is also going up. The earning capacity of people. So everybody wants to keep their money. So sabi ko, kung meron tayong pera, pahiram na lang natin. So ikot ng ikot yan. Then we can maintain a scholarship. So when I brought this topic to the Medical Alumni Association in America, particularly yung MAA natin, in that meeting alone, the president pledged $10,000 and the rest of the officers they pledged a total of $5,000. So in that meeting alone, I was able to get a pledge of $15,000.
Huwag mo sabihin yan dito sa baka paglabas mo rito.
Tapos, so nung sinabi ko sa UE, sabi ko, you promise me na tatapatan ninyo whatever ang aking ano. So our alumni through Sam Erastorza is going to do something about this. I think yung batch namin na meron nakalaan na another 15,000 na nandun sa US. In fact, alam mo ang batch namin, nagbigay sa akin ng mga 300,000 plus as Dean's Contingency Fund. Now, every time a student encounters problem, for example, hindi makabayad sa kanyang installment, pinahihiram ko.
Wow.
Yes. And then, at the end of the semester,
Personal
binabalik
money mo,
niya.
sir?
No, money ng batch namin. So, I was able to, they gave me 300,000 plus. So, the money is still intact, but we have helped a number of students already. So, kung minsan, hindi ka agad makakarating kanilang pera at mag-examination na. So, sabi ko, sige, I will guarantee that 50,000 for this student. And then at the end of the semester, binabalik naman nila.
Wow, congratulations. TPC sa school nyo, Ateneo, hindi ko alam kung
Uso ba sa inyo ang student loan?
Oo. Meron
Ayun
din.
po, Doc, wala kaming student loan, but we actually have two committees na well-established na po dati. We have a financial, parang fundraising committee, and we have a scholarship committee na both of them are under the office of the dean. So, kumbaga sabay po na nag-work tong dalawang committees. Pero admittedly, during this pandemic, nag-overtime talaga ang scholarship committee namin. Part din po ako ng committee na yun. Kasi talagang kailangan po i-review. And ang maganda naman po, because of yung cura personalis that we believe in, yung talagang we examine each of the cases to see sino ba talaga dito yung may kailangan at saka sino ba yung urgent talaga na unahin natin to. So nangyari din po siya.
Okay. Are you all involved in residency training program also? TP? May question kasi dito. I don't want to address it to myself, no? Kasi
Hindi naman. Ako na lang magtatanong sa'yo. Gusto mo?
tanong ko rin sa inyo, how was the residency training in general during the pandemic? May mga residents ba nag-stop o may mga residents ba nagkaroon ng mental health issues? Anong experience niyo doon sa mga residents and or fellows, no?
Yeah.
Di ba?
Merong isa o dalawa, something like that. But in general, yung ating mga residents, siguro well-screened naman sila.
Yeah, na may psychological examination naman.
Yeah.
Sa inyo, TP, meron ba kayo experience on the...
Right. So karamihan ng graduates namin nagtutuloy sa medical city naman, di ba? Kasi
Yeah.
yung partner hospital namin. Nakita namin, alam mo, sobrang workforce ng ospital ang mga residents. Lalo na halimbawa sa pediatrics. Yung chief res at that time was also a graduate of our school. Nakita mo how he maneuvered? Kasi pati ER, para ilayo dun sa COVID areas, inakyat sa 6th floor, ganyan. So, tingin namin dun niya na-apply yung MBA skills niya, yung pagka-pivot nila. So, I think yun yung maganda sa mga residents, no? Pero, syempre, pati curriculum nila, pinalit. 'Di ba? Kasi there was a time parang skeletal lang, hindi pwedeng pumasok or kailangan ingat na ingat ka talaga. So, medyo may similarities din yung nangyari dun sa residency and fellowship training program na nag-convert din siya to tele. Pero yun nga, mas nauna silang bumalik din sa mga face-to-face kasi.
Pero sa pediatrics, di ba, TP, kumonti yung case. Di ba? Hospital.
Kumonti. Alam mo actually, lahat ngayon, pati halimbawa, example lang, ang HMO ng Ateneo, nakita nila halos walang gumagamit ng HMO cards ngayon kasi takot ang tao lumabas para magpakonsulta. Lalo na nung start ng pandemic ha. So ngayon nakikita natin, okay, medyo bumabalik. Kasi ang nangyari dati, yung talagang malala na or talagang hindi na makahinga. Sila yung pumupunta sa ospital. So yun yung parang shift din.
So ang problem kasi sa fellowship and residency training, yung cases talaga na nawala siya. No, yung mga dapat na ma-experience yung kumonti siya. So lahat ng nakita nila, lalo na nung surge of the first wave ng pandemic, talagang COVID lang. And sa experience namin, ako sa St. Luke's and UERM, noong unang mga days, hindi namin parang ina-allow yung mga residents to go into the COVID ward until matutunan ng mga consultants how to deal with COVID. No? So, doon lang sila papasok. Kailangan papasok din yung mga consultants. No? Tama, sir, no? Kasi that's fair. No?
Yeah.
Dapat consultants muna yung pumasok before letting the residents go into the ward or COVID ward and manage them. So, yun siguro. Pero nowadays, after November of December, but dumami na yung cases parang bumabalik na sa normal yung ano. And nagkakaroon na kami, madali na yung parang automatic na ang social distancing, mask when talking, wala na masyadong, and nowadays wala na rin masyadong mga residents and fellows na nagkakaroon ng COVID. No? So talagang experience na yung mga ano. And ganun pa rin, it's about, ano tawag nito, sir? Formative, no? More of formative. Before you doing the summative, sir. Okay, sir, meron kayong experience sa
yung
mga
sa residente naman, ang kanilang exposure sa mga consultants natin dumami. Dahil teleconference, dati, pag meron tayong mga conferences, 2, 3, 4 ang consultants nandyan. Ngayon, halos lahat ng consultants. They don't have to travel.
Tama yun, sir. No? So, yung mga interaction with actually mas marami na ngayon nag-a-attend ng mga consultants sa conferences. Parang 85% of the
and the residents are getting varied,
Oo, di ba?
Inputs,
Naalala ko, sir, siguro yung ating mga parang Thursday conference, 10 consultants lang. Ngayon parang nasa 50 na
50. 120 attendees.
Lalo na nung search ng COVID, yung talagang gusto nila matutunan about COVID. Kayo, TP,
Ganun din yung experience namin. Kasi ngayon walang traffic. Wala lang excuse na live po Parang ang medyo naging mahirap lang ngayon is yung pagkasunod-sunod ng lahat ng meeting. Parang wala ka lang breathing time minsan kasi one meeting after the other, parang hindi ka pa nakakatayo. Ito na yung susunod. So, pero in terms of exposure, I think yun yung maganda rin na nangyari, no? Kumbaga, theoretically, yung cognitive knowledge ng ano natin, ng trainees, natutukan din siya.
Yeah. Ito naman, sir, di ba sa inyo rin yung interns and clerks, no? So, pumayag ng APMC, no, na pumasok na sila.
Yes,
ngayon.
yung
so,
CHED.
Kahit CHED pala. CHED pumasok na sila.
Yeah.
So talagang ngayon puspusa na lahat ng pa-exposure sa mga, of course, non-COVID patients.
Yeah. At saka, of course, limited. Ang tawag nila, limited face-to-face. So, very, very specific yung competencies, yung mga skills na
dapat
matutunan nila. So, we want them to be with us for as long as necessary, as long as it is necessary to achieve those competencies. The moment na nila, sabi ko, let them go.
So hindi ba kayo rin TP ganun na rin pumayag na rin ng CHED sa sa Ateneo. So yeah. Okay, last question. So we all know these students of ours right now, lalo na yung clerks and interns, no, who have less exposure to patients. So, and later on, siguro kami, no, baka they will be our doctors pagka tayo naman yung nagkasakit, sir. No? So, what's your insight on that? Magiging okay ba sila as a doctor? Ano bang ano?
As I said earlier, from the beginning, very, very clear ang aming program objectives, yung competencies, yung skills namin. So, we're confident that at the end of their training, na-accomplish nila yon. So, at the same time, pukpok sarado namin sila on decision making, problem solving, and decision making. And we all know na tayo pag nagmamanage tayo ng pasyente, about 90% actually ng ginagawa natin is problem solving, decision making. And for as long as yung dalawa na yan ay tama, I'm confident na they can take care of me very well.
Thank you very much, sir. Good to know. TP?
I agree with Sir, no, na as long, balik tayo lagi sa learning objectives. Hindi naman natin sila papakawalan if we think hindi pa talaga achieve yung learning objectives. Pero siguro ang isang thought ko rin dyan, may panahon pa naman. 'Di ba, as doctors, we're lifelong learners. So, kahit na medyo bumagal tayo ngayon, or medyo na-stall, or medyo na-discarrelate, na iba yung path natin to learning, there will still be other opportunities for our students to continue learning. And pati tayo, di ba, sabi mo nga, ang dami mo natutunan ngayon, manipulate ka na ng vent ngayon, di ba? So, as long as we have that in our minds and in our hearts, I think I'm confident. Pagagalingin tayo ng mga estudyante.
Ako rin man po. Mel?
Agree din. I agree. As early as first year, we are already exposing them to critical situations. Theoretical nga lang. And I believe that if we teach them how to learn, that is maybe what to learn, if we teach them how to learn, they will, in the future, look for answers themselves. Okay, so what if they feel that there's something lacking in this present setting, maybe in the future they will find ways to augment yung mga kulang ngayon. Okay, so matututo naman sila later on. Hindi lang ngayon, pero later on, of course, yes. There is always this willingness to learn.
Yung sinasabi nilang adult self-directed learning.
Okay, so almost an hour already, no? Or lagpas na. So, no more than na. So we'd like to hear final message. Siguro yung message nito, message for the students, no? For our future doctors. So, Dr. Uy?
So, first, I'd like to congratulate Bart sa 96.
Thank you, sir.
We are very, very proud of your achievements. Talagang ano.
Tutulong kami,
And,
sir.
Sana tularan kayo ng aming mga estudyante, ng ating estudyante
Yes.
ngayon. Yun lang naman ang aming ano na sa inyong pinapakita sa kanila, tularan kayo. Katulad lang sila sa inyo eh. Okay na.
Thank you,
kami.
sir. TP?
Sige, ako siguro pasasalamat din sa UE. I stayed in UE for just 4 years kasi sa labas na ako ng PGI residency and di ba? Pero I feel that the education that I got from UE is actually very formative for me as a person and for me as a doctor. And yung rigor na yon, nakikita ko pa rin hanggang ngayon the way our Dean Ling here is expressing how the curriculum has pivoted and all. So siguro ang message ko lang din sa students natin is value the education that you're getting now. Kumbaga pigain nyo talaga, get what you can get from it. And then dream on how you can use this later on to uplift the patients that you will serve. So siguro yun lang. Maraming salamat.
That's true. Mel?
Yeah. Okay, so dream. Okay, dream din. Okay, pero sana hindi laging dream kasi tulog yun eh. So you must be also yung matututunan sa UE, carry it with you always. Okay, like TP said, yung natutunan niya, and also what I learned from you is it's not just the yung mga skills and cognitive, but also the values that I learned. Okay, yung integrity, honesty. So that's how we should be, how we should carry ourselves outside UE pa rin. Okay, and even when you graduate, carry yourselves with confidence, tsaka with pride. Na-graduate ka ng UERM.
Yeah, I'd like, of course, for me, I'd like to thank, of course, UERM na tatak Ramon, ano? Kung paano ako tumingin ng pasyente, kung paano, how to deal with consultants, no? And how to deal with students. No? Meron talagang tatak Ramon. So I'd like to thank UERM for this one, College of Medicine, and I'd like to tell Dr. Uy na we're here to help also our batch. No? And of course, some would say it na Sammy Rastorza would also say that the UERM Alumni Association or the College of Medicine Alumni Association is here to help you also. And remember, students, no? The primary objective of our profession is to serve humanity. So with that objective, magkakaroon kayo ng eagerness and zealous to learn, no? On how to treat your patient properly. With that, thank you very much, Tatak Ramon. Thank you very much, Dr. Uy.
Thank you.
PP and Mel, thank you very much.
Thank you.
Good evening again, everyone. Sadly, this is the last webisode for this webcast series for now. Okay, if you want more series, just tell us and comment down there. On behalf of the class of 1996 and the UERM College of Medicine Alumni Association, I'd like to thank the following resource speakers: Dr. Mario Panaligan, Dr. Minet Rosario, Dr. Agnes Bueno, Dr. Maria Felicidad Soto, Mr. Joe Ferreira, Dr. Norbert Lingling Uy, our Dean of the College of Medicine, Dr. Michael Baccay, our batchmate speaker for this year's Dr. Potenciano Baccay Memorial Lecture, and the President of our association, Dr. Sam Irastorza, and the Board of College of Medicine Alumni Association. Of course, my batchmates, the class of 1996. Mabuhay tayong lahat. Special mention to the organizing committee, Ejam, Shira, Neri, Jing, and of course, Lynn. Say hi to your husband also. Thank you for the help. And Macy, Alice, Allen Apeng, Alma, Anafe, Ana Chua, Beth, Chris, Denise, Lizelle, Lenlen, Tina, Dingdong, Marie, Martini, Pinky, Roger, Ronnie, and Sheila. This would have not been successful, our activities, if not for their help and work. And to our virtual host production team, the Dr. Carl E. Balitas Virtual Interactions, Conferences and Events, or CBRC Vice. Maraming salamat po for making this event memorable and unforgettable, that despite the limitations posed by this pandemic, we were able to overcome those setbacks and was able to come up with a series that is innovative, engaging, and learn-entertaining. Thank you everyone for your continued support for this series. If you want more, request lang kayo. Again, good evening, Tatak Ramon.
This now concludes the webisode 4. I'm formally closing this session. Thank you to those who attended and participated in this webcast series. Keep well and safe, everyone.